Hello, my name is Tiffany Gavin, and I'm an LPN. I understand that the doctor has just informed you that you're going to need to give yourself daily insulin injections. I also understand that the doctor has covered with you the types and amounts of insulin that you will need to be using. He's asked me today to show you how to give yourself an insulin injection. Insulin is given subcutaneously, which means it goes into the fat layer under your skin. Subcutaneous injections are very safe and very simple to give. I've been working with diabetic patients for over 3 years now, and I understand that there's some nervousness and reservation about giving yourself a shot. It's completely natural, but I'm sure that once you've learned how to do it and had a chance to practice it, that nervousness will go away. What we'll learn today are the materials that you will need, how to drop your insulin, where on your body is safe to give an injection, and how to give that injection. First thing you're going to do is gather up your supplies. You will need your vial of insulin, a syringe marked in units, some alcohol swabs, a 2x2 gauze pad or a cotton ball if you don't have these, a pair of gloves if someone other than yourself will be giving the injection, and some place to dispose of your syringe. In my case, I will use a mason jar. Once you have all your supplies, you'll wash your hands, open up one alcohol swab, and clean off the rubber stopper of your vial. Put that to the side and let it air dry. For the purpose of this demonstration, I'm going to drop 5 units of insulin, so I'll pull down on my plunger till I hit the number 5, uncap my needle, and insert it into the rubber stopper. Push down on the plunger to inject the air, and then turn your vial upside down. We'll then pull down the plunger till we hit the number 5. We'll pack a little bit past that just to make sure you don't have any air bubbles. If you do, you can just push it right back up, and the bubble should go back into the vial. Pull out your syringe. In my case, I'm going to use the scoop method to recap it. I don't recommend that. You will have safety syringes. There'll be a little contraption on the side of your syringe, and you'll just push up with your thumb to recap your needle. Put that to the side, and now you're going to determine where you're going to give yourself the injection. There are several safe areas of your body to do so. You can use the backs of your upper arm, your thighs, and your abdomen, as long as it's 2 inches away from your belly button. You also want to make sure that you rotate the sites. And what I mean by that is that you don't want to use the same area of your body repeatedly for an injection. Now, when you're going to give yourself the injection, we are going to use a rolled up washcloth as our skin. You'll open up another alcohol swab, cleanse the skin and let it dry, uncap your needle. You're going to pinch a little bit of skin, and with the other hand you're going to hold the needle like a dart. I want you to come in at a 90-degree angle and very quickly insert that into the skin, release with your other hand, and stabilize the syringe. You're going to push down on the plunger very slowly and inject the insulin into your skin. You want to wait a couple seconds to make sure that all the insulin is out and into the skin. Pull out in the same direction you came in, and then dispose of that into your container. If you see any blood on there, you can use your gauze pad or cotton ball and just apply a little bit of pressure on that, and it should stop bleeding. And that's really all there is to it. Today we have learned what supplies you will need to give yourself an injection, how to drop your insulin, where you can give yourself an injection, and how to give that injection. Do either of you have any questions for me today?
Yes. Why do I need to rotate my injection sites?
You want to ensure that you rotate your sites so that you don't cause tissue damage. Tissue damage can include redness, pain, swelling, and bruising. You can keep a little list and write down where you've given yourself a shot. That way you make sure you rotate every time.
Okay, and how do I store my insulin?
Insulin is best kept refrigerated until you need to use it.
Why do you have to check for air bubbles in the needle?
If you have air bubbles in your syringe, that's taking the place of the insulin, which means that she'd be getting the incorrect dosage.
Why does she have to get a shot? Can't she just take a pill or something?
No, insulin is a protein, which means if you ingested it orally, that your stomach would break it down before it had a chance to do its work. Do either of you have any other questions? In conclusion, let me say that the more you practice this, the better off you're going to be, the easier it's going to become, and you'll be a pro in no time. Thank you.